All right, ready to explore the incredible world of muscles.
The ones that make all those movements possible, yeah. We'll be using the Concise Book of Muscles to guide us.
Perfect. We're focusing on the major skeletal muscles, but in a way that everyone can understand.
No need to memorize every single one. We want you to grasp those light bulb moments, those insights into how our bodies move.
Exactly. So first, let's decode those tricky anatomical terms like anterior and posterior, all that stuff.
It's like learning a new language, but don't worry, we'll be your translators. Anterior means front, posterior means back, superior up, inferior down. You get the idea.
Okay, makes sense. But what about when we're talking about limbs? How do we know which direction is up or down then?
Ah, that's where proximal and distal step in.
Yeah.
Proximal means closer to the body's center, so like your elbow is proximal to your wrist.
Because it's closer to my shoulder.
Exactly. Distal means further away, so your wrist is distal to your elbow.
Got it. So these terms act like our compass for navigating the body.
Precisely. And just like a map has layers, we also have terms to describe depth. Superficial is closer to the surface, deep is further inside.
My skin's superficial then, and my bones are deep.
You got it. And for hands and feet, we have special terms. Dorsum is the back of the hand or top of the foot, palmar is specific to the palm, and plantar to the sole of the foot.
Our anatomical compass is ready then. But before we get to the muscles, we need the framework they attach to, the skeletal system.
Absolutely, the skeleton. It's divided into the axial skeleton, that central axis of your body, with the skull, vertebral column, and rib cage.
And the appendicular skeleton is everything attached to that, right?
Yeah.
Our limbs and such.
Precisely. Now on to the stars of the show. Muscles. They're attached to bones by tendons, and we use the terms origin and insertion to describe these attachments.
Okay, tell me more about those terms.
Imagine you're lifting a dumbbell. Your biceps muscle originates on your shoulder blade. That's its ankle point.
Okay.
The insertion is down on your forearm. It's the point that moves as the muscle contracts.
Like the fixed end of a rope, and the end that gets pulled.
Perfect analogy. Now, muscles don't just contract in one way. We have isometric and isotonic contractions.
I've heard those before,
Yeah.
but could use a reminder.
Holding that dumbbell steady in a curled position, your muscles are working, but no movement at the joint. That's isometric. Tension, but no shortening.
Like holding a plank.
Exactly. When you lift or lower the dumbbell, that's isotonic. Shortening or lengthening while generating force.
Isometric is holding steady. Isotonic is movement.
Got it. Now, isotonic contractions can be concentric or eccentric.
This is where I get a little lost.
No worries, it's easy.
Yeah.
Concentric is like flexing. The muscle shortens as it generates force, lifting that dumbbell up.
Okay, makes sense. What's eccentric then?
Eccentric is when the muscle lengthens, but it's still under tension, so like slowly lowering that dumbbell.
So my muscles are working even when I'm lowering a weight. Wow.
Precisely. But here's the fascinating part. Muscles hardly ever work alone. They team up to create smooth, coordinated movements.
Like a dance.
Exactly. We have prime movers, the agonists, those are the main drivers. Then we have antagonists, which oppose that action to allow movement.
Like opposites.
Precisely. Then we have synergists, helpers that refine the movement or stabilize the joint. And fixators, these provide a stable base for the prime mover to work from.
So every time we move, it's a team effort.
It really is. Let's put this knowledge into action, starting with those muscles responsible for facial expressions.
Okay, and ready.
First up, the epicranius. It's two muscles connected by a sheet of tendon that sits on your skull like a helmet.
Okay, I can picture that. What do those muscles do?
One pulls the scalp back, the other pulls it forward, creating those forehead wrinkles when you raise your eyebrows.
So it's a tug of war on your forehead.
Exactly, all orchestrated by the facial nerve.
Now on to the muscle behind those sparkling eyes, the orbicularis oculi.
This one actually has three parts, each with a unique role in moving and protecting the eye.
Okay, so what's the first part specialty?
Forcefully closing your eyelids, squeezing your eyes shut. The second part is about gentle closing, like blinking.
And the third part, that's the one connected to tears, right?
You guessed it. It helps drain those tears. Isn't it amazing how much is going on just to blink?
Really is. Makes those eye creams seem a bit less impressive.
Now, let's talk about the corrugator supercilii, the muscle behind those thinking wrinkles.
I think I can feel that one working right now. Where is it and what does it do?
It's a small muscle running from your frontal bone to the skin under your eyebrow. When it contracts, It pulls those eyebrows together.
Creating those vertical wrinkles.
Precisely. The muscle of concentration, or maybe skepticism?
Let's move down a bit to the procerus, the nose wrinkler muscle,
Ah, yes, the muscle that springs into action when you encounter a bad smell.
like durian fruit.
Exactly. It wrinkles the skin at the top of the nose, creating that scrunched up look.
Okay, what about the nasales?
The nasalis has a more functional role. It controls airflow through your nostrils. Think flaring them for a deep breath.
So it's not just about expressions, it helps us breathe.
Precisely. Now on to a real multitasker, the orbicularosaurus.
Has to do with the mouth, I'm guessing?
Spot on. It's the muscle encircling your mouth, responsible for all sorts of lip movements from closing to puckering.
Wow, so everything from eating to speaking to kissing.
Precisely, a very complex structure.
Okay, let's keep going. What's next?
The levator labii superioris, the muscle that elevates the upper lip.
Contributing to a smile or a sneer. Where's it located?
It originates from your zygomatic bone and maxilla and inserts into structures around the upper lip and nose. It even helps dilate your nostrils.
That little muscle sure does a lot.
It does. Now let's focus on the key muscle for a genuine smile, the levator angulioris.
Let's turn that frown upside down.
It originates from the canine fossa of the maxilla, that little depression on your upper jawbone, and inserts into the corner of your mouth.
Ah, so it pulls the corner of the mouth upward.
Precisely. And speaking of smiles, the zygomaticus muscles.
Major and minor, right?
Yes. The zygomaticus major is the one responsible for a big, beaming smile, pulling those corners up and back.
What about the minor then?
It also helps with smiling, but it's more about elevating the upper lip and shaping that nasolabial furrow, the crease running from your nose to the corner of your mouth.
The fine-tuning muscle for our smiles.
Exactly. Now let's shift to the muscles that pull our mouths down a bit, starting with the depressor labii inferioris.
That was for pulling the lower lip down, I'm guessing.
Spot on. It goes from your mandible to the skin of your lower lip, creating those expressions of sadness, pouting.
Or when you eat kale.
Perhaps, and working with it is the depressor angulioris.
Pulling the corners of the mouth down.
You got it. It's interesting to note that its fibers blend with the platysma muscle.
Okay, filing that away. What about the mentalis? What role does it play?
That one's all about the chin. It protrudes the lower lip, wrinkles the chin, adds to those pouting expressions or doubt.
The muscle that gets a workout when pondering life's big questions.
Quite possibly. Now let's talk about the platysma.
Isn't that the one that gets tense when you're stressed?
Yes. It's that broad, thin sheet of muscle covering much of your anterior neck. You can see those tendons stand out when someone's tense, startled, or exhausted.
Okay, but what does it actually do?
It pulls your lower lip down, contributes to expressions of surprise or fear. It also draws the skin of the chest upward.
Involved in facial expressions and neck movements, then.
Precisely. Now let's discuss the buccinator, crucial for blowing and sucking.
Like blowing out birthday candles or sipping through a straw.
You got it. It forms that muscular wall of your cheek, helps control air and liquid in your mouth.
It's working even when we're not aware of it.
Exactly. Now, let's shift gears to those muscles that make chewing possible. The muscles of mastication. First, a true powerhouse. The masseter.
I can feel it working just thinking about a nice steak.
It's one of the most powerful muscles, the one you feel on the side of your jaw when you clench your teeth. It lets us close our jaws with incredible force.
So it's what gives those competitive eaters their edge.
Quite possibly. And it helps with side-to-side grinding.
We talked about the facial nerve controlling those facial muscles. What about the masseter, though?
The trigeminal nerve, cranial nerve V, is in charge there.
Different nerve, then.
Exactly. Now, working with the masseter is the temporalis.
I can feel that one, too, when I clench my jaw. Where is it?
That broad, fan-shaped muscle covering your temporal fossa, that depression on the side of your skull.
It does.
It closes the jaw like the masseter and helps with grinding. Think biting into a crunchy apple.
Dynamic duo. And is it also controlled by the trigeminal nerve?
You got it.
It's amazing how interconnected it all is. What's next?
Let's delve a bit deeper. The pterygoideus lateralis. It's more hidden and has a slightly different action.
Okay, I'm listening. What's its special skill?
It protrudes the mandible, brings your lower jaw forward, helps open your mouth wide, and assists with grinding.
It's the muscle that lets us take a big bite.
Exactly. And yes, also controlled by the trigeminal nerve.
Trigeminal nerve, the master conductor of chewing.
Indeed. Now for the last muscle in this group, the pterygoideus medialis.
What is it?
Works with the masseter, helps elevate and protrude your mandible, closing your jaw, clenching, and side-to-side grinding.
The backup singer to the masseter.
Perfect analogy. We've spent some time on the face, head, and neck. What stands out to you about all of this?
It's just amazing how complex it all is. Never realized how many muscles are involved in simple things like making a face or chewing food.
It's pretty incredible, right? And we're just getting started.
Can't wait to learn more. What's next?
Let's shift to those muscles of the trunk, the core, supporting posture and allowing us to move our torsos.
Okay, ready to dive in.
Great. Let's start with a group often linked to back pain, the erector spinae.
I've heard of those. They're super important for core strength, right?
Absolutely. It's actually a group of 3 muscles running along your spine, the iliocostalis, longissimus, and spinalis. They help us bend backward and sideways and are key for good posture.
So if I'm slouching, they're the ones protesting.
Exactly. Now let's go deeper to the semispinalis capitis, cervicis, and thoracis, part of a group that lies beneath the erector spinae.
Closer to the spine itself.
Precisely. They help extend and rotate your spine. The semicinalis capitis is the powerful one, helps you look upward.
It's the stargazing muscle.
Exactly. Now for the splenius capitis and splenius cervicis, working together to extend the head and neck and rotate your head.
A tag team.
Yes. They originate from the ligamentum nuchae and spinous processes of your vertebrae and insert into the skull and upper cervical vertebrae.
Getting into the nitty-gritty.
We are. Now for a muscle crucial for stabilizing the spine, the multifidus. It lies deep beneath the erector stina.
Providing deep internal support.
You got it. Its fibers span several vertebral segments, giving support and control over each one.
Like a series of tiny braces.
A great analogy. It prevents too much movement and protects those spinal joints. Now, deep within this system, we find the rotator's muscles.
Even smaller, more specialized. What do?
They mainly rotate the vertebral column and help with extension, like tiny fine-tuners.
It's just incredible how all these muscles work together.
It is. Now let's shift to breathing.
Okay, I'm ready to breathe deep.
Excellent. We'll start with the external and internal intercostals, those muscles between your ribs.
I've seen those in diagrams. What's their role in breathing?
We have 11 pairs of each, running between your ribs. The externals are the outer layer, the internals lie beneath them.
A double layer.
Precisely. Their main job is to stabilize your rib cage during movement. They also help with breathing itself. Externals with inhalation, internals with exhalation.
A dynamic duo for the rib cage.
Exactly. And they receive their signals from the intercostal nerves.
We can't forget the diaphragm, right?
Absolutely not. It's that dome-shaped muscle separating your chest from your abdomen.
It's the main muscle for breathing.
It is. When it contracts, it pulls downward, drawing air into your lungs, responsible for about 60% of our breathing capacity.
That's impressive. Which nerve controls it?
The phrenic nerve, all the way from your cervical spinal cord. Direct line of communication from your brain to this muscle.
Amazing.
What's next?
Let's discuss the cremaster muscle.
The one for temperature regulation in the testes.
You got it. It surrounds the spermatic cord and testes, pulling them closer when it's cold and letting them descend when it's warm.
A built-in thermostat.
Precisely. Now, those muscles that give us those sculpted abs, the obliques.
The muscles that make side planks tough.
The external oblique is the one you see. Its fibers run diagonally.
And the internal oblique runs the other way.
Precisely. Crisscrossing, compressing the abdomen, supporting those organs, and helping with bending and twisting motions.
So they're not just for looks, they're crucial for stability.
Right. Deep beneath them is the transversus abdominis.
I hear about that in fitness classes.
It acts like a corset, supporting your organs, stabilizing the spine. It even helps with exhaling forcefully, like coughing.
It's working even when we don't realize it.
Precisely. Now, of course, we have to talk about the rectus abdominis, the six-pack muscle, the most famous one.
It runs down the middle of your abdomen. It's actually divided into sections by tendinous intersections, which creates that six-pack look.
Besides looking good, what does it actually do?
It flexes your lumbar spine so you can bend forward and depresses the rib cage. It helps stabilize your pelvis while walking too.
So it's not just a vanity muscle.
Exactly. Now, for a muscle often overlooked but crucial for the lower back, the quadratus lumborum.
I don't stretch that one enough.
Yeah.
Where is it and what does it do?
Tucked away deep in your back, connecting the iliac crest to your 12th rib.
So it's positioned for lower back support.
It is. It helps you bend sideways, stabilizes your 12th rib when breathing deeply, and even helps extend the lumbar spine.
It's a multitasker.
It is.
Yeah.
Now, for a muscle spanning the trunk and the hip, the iliopsoas.
I've heard of that from yoga.
It's key for hip flexion and posture. It's actually two muscles joining together.
It connects the spine to the thigh bone.
Exactly. It helps bring your thigh toward your chest and stabilizes the lumbar spine.
Everything is connected.
It is. Now we're moving on to the shoulder and upper arm.
Okay, I'm ready.
Excellent. Starting with a muscle we've already encountered, the trapezius.
The large diamond-shaped muscle in the upper back and neck, it
Well,
moves the scapula.
exactly. It originates from the base of your skull, the ligamentum nuchae, and the spinous processes of your vertebrae.
Wow, that's a lot.
It does a lot too. It elevates, retracts, depresses, and rotates the scapula depending on which part is contracting.
Wow, so it's involved in a wide range of shoulder movements.
Precisely. Now, what about the levator scapulae? It moves the scapula too, right?
It does. It elevates the scapula and helps retract it.
And assists in bending the neck laterally. Imagine reaching for something high up. That's your levator scapulae at work.
Not just shrugging then.
Right. Now, the rhomboid muscles, major and minor, they lie beneath the trapezius and work to stabilize the scapula.
Like a support team.
Precisely. They retract the scapula, prevent it from winging out, essential for posture.
And probably overworked if you're hunched over a computer all day.
You got it. Now, the serratus anterior, vital for protracting the scapula.
Pulling it forward.
Exactly. It's a large muscle originating from your ribs. When it contracts, it pulls the scapula forward, enabling us to reach forward or push things.
Like pushing open a door.
Exactly. Now, let's talk about the pectoralis minor, often overlooked because of its bigger counterpart, the pectoralis major.
The pecs. What does the minor do?
It draws the scapula forward and downward and can even help raise the ribs when you inhale deeply.
It helps us breathe.
It does. Now, for the pectoralis major itself,
The star of the show.
it originates from your clavicle, sternum, and ribs and inserts into the humerus, your upper arm bone. It adducts and medially rotates the humerus, brings your arm toward your body, and rotates it inward.
That's what makes bench presses possible.
It also flexes and extends the shoulder joint. Quite versatile.
It is. What about the latissimus dorsi, the muscle that gives you that V-shaped back?
It originates from an aponeurosis attached to the vertebrae, iliac crest, and lower ribs and inserts into the humerus, just like the pectoralis major.
Same bone, opposite side of the body.
Exactly. It extends, adducts, and medially rotates the humerus, bringing the arm back towards your body. It's key for pulling and climbing.
It's amazing how they work in opposition.
It is. Now, for the deltoid, the muscle giving your shoulder its rounded shape. It has three parts, anterior, middle, and posterior.
And each part does something different.
You bet. Anterior flexes and medially rotates the humerus, middle abducts it, and posterior extends and laterally rotates the humerus.
A full range of motion then.
Exactly. Now, for those muscles that are super important for shoulder health, the rotator cuff muscles.
They're crucial for athletes, right?
Absolutely. The supraspinatus, infraspinatus, teres minor, and subscapularis, they surround the shoulder joint, keeping the head of the humerus in place.
Bodyguards for the shoulder.
I like that. Supraspinatus starts abduction. Infraspinatus and teres minor externally rotate the humerus. Subscapularis internally rotates it.
Constantly working to keep that joint stable.
They are. Now, the teres major,
I'm guessing that's...
often confused with the teres minor.
I can see why. So are they basically the same muscle?
Not really. They're both in the shoulder region, but they have different actions. Teres major helps with adducting, extending, and medially rotating the humerus.
So similar to the latissimus dorsi.
Precisely. Think rowing or pulling movements.
It's like the latissimus dorsi's little helper.
Exactly. Now, let's move down the arm to those forearm and hand muscles. They're responsible for so many movements.
Okay, ready to get a handle on those.
All right, we'll start with the pronator teres, crucial for turning your palm downward.
Pronation.
Yes. So the pronator teres is why we can turn doorknobs or use screwdrivers.
Makes sense.
It works with the pronator quadratus to control that movement.
Tag team for pronation. What about those muscles that let us bend our wrists forward?
Ah, the wrist flexors. Flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. They originate from the medial epicondyle of the humerus.
That bony bump on the inside of the elbow.
You know it, and they insert on different bones in the hand.
It's like they're each grabbing a different part of the hand to create that bending motion.
Exactly, working together.
Now, what about making a fist, that gripping action?
The finger flexors. Two main players here, flexor digitorum superficialis and flexor digitorum profundus.
I always mix those up. What's the difference again?
Think of it this way. Superficialis is closer to the surface, Inserts into the middle bones of your fingers so you can bend those middle joints.
Okay.
Profundus is deeper, inserts onto the fingertip bones, letting you flex your fingertips.
Ah, so they work together to give us that full range of motion.
Exactly. Now, over on the thumb side, we have the brachioradialis. It helps with flexing the elbow.
Not the primary flexor, though.
Right, it assists. Most active when your forearm is in a neutral position between pronation and supination.
A balanced approach.
Yes. Now, for the supinator, this one helps turn the palm upward. Supination.
The opposite of the pronator, then.
Exactly. It originates from the humerus and ulna and wraps around the radius, turning a screwdriver, opening a jar, all thanks to the supinator.
It's amazing how those simple actions involve so many muscles.
It is. Now, we have flexors for the wrist, but we also have extensors that bend the wrist back.
Like when you're typing or playing piano.
Precisely. Extensor carpi radialis longus, extensor carp radialis brevis, and extensor carpi ulnaris.
And straightening the fingers.
Also extensors, extensor digitorum, extensor indicis, and extensor digiti minimi.
It's a constant push and pull.
It is. Now let's dive into those tiny muscles of the hand that give us such incredible dexterity.
The dexterity zone.
Thenar muscles, hypothenar muscles, and intermediate muscles.
Each with its own territory.
Exactly. Thenar muscles, those are all about thumb movement, located on the thumb side of your palm.
So they're the reason we can use our thumbs so well.
Precisely. Now, on the opposite side, we have the hypothenar muscles controlling the little finger.
Mirroring the thenar muscles.
They do. And in the middle of the palm are the intermediate muscles controlling the index, middle, and ring fingers. They refine those really intricate movements.
It's amazing what our hands can do.
It is. Now let's shift our focus downwards to the muscles of the hip and thigh. The powerhouse muscles for walking, running, and jumping.
Ready for those.
Starting with the gluteus maximus, the biggest and most powerful muscle we have.
The glutes.
It originates from the ilium, sacrum, and coccyx, and inserts into the gluteal tuberosity of the femur and the iliotibial tract.
So connected to both the pelvis and the thigh bone.
It extends and laterally rotates your hip joint, stabilizes your pelvis, and helps keep you upright.
So it's not just about looks, it's crucial for so many movements.
Exactly. Now, for a muscle that often gets overlooked, the tensor fasciae latae.
I don't know how
It's on the outer side of your hip. It helps flex, abduct, and medially rotate the hip joint.
But you said it stabilizes the knee.
Yes. It tenses the iliotibial tract, essentially acting like a supportive strap for the knee, especially when it's straight.
It does double duty.
It does. Now, for the gluteus medius, important for hip abduction.
Moving the leg away from the body.
Precisely. It originates from the ilium and inserts into the greater trochanter of the femur.
I've heard it can be weak in people with knee problems.
That's right. Weakness can throw off the mechanics of the hip, which then impacts the knee.
So strong glutes are important for joint health.
Absolutely. Now, deep to the gluteus medius, we have the gluteus minimus.
Does the same thing, but on a smaller scale.
Pretty much. Helps with abduction and medial rotation of the hip, working with the gluteus medius for control and stability.
A tag team. What about the piriformis? Doesn't that one cause sciatica?
It can. It's a small muscle deep in the buttock, and the sciatic nerve runs right by it. If the piriformis gets tight, it can press on that nerve.
Ouch.
Right, so keep it stretched. Now, working alongside the piriformis are 5 other muscles.
They're deep in the hip.
Yes. They're called the deep lateral rotators of the hip. Obturator internus, gemellus superior, gemellus inferior, quadratus femoris, and obturator externus. They laterally rotate the hip and contribute to stability.
So many muscles.
Right. Now, on to the hamstrings. Essential for running, jumping, and bending the knee.
The ones that always get tight.
3 muscles on the back of your thigh. Biceps femoris, semitendinosus, and semimembranosus. They originate from the ischial tuberosity.
The sitting bone.
You got it. They flex the knee, extend the hip, and help rotate the leg. They're powerful, but they can easily get overstretched and strained.
I know that feeling. What about those muscles on the inside of the thigh? The ones that get sore from side lunges.
The adductors. Adductor magnus, adductor longus, adductor brevis, pectineus, and gracilis. They adduct the hip, pulling your leg in towards your body.
So they're active in movements that involve moving your legs sideways.
Exactly. Now, the gracilis is interesting because it crosses both the hip and the knee.
A two-joint muscle.
Precisely. So it assists with hip adduction, knee flexion, and even medially rotating the leg when your knee is bent.
A lot going on there. And the pectineus, I remember that one does hip adduction too.
It does. It's in the groin area, helps with flexing, adducting, and medially rotating the hip.
It's incredible how all these muscles work together.
It is. Now for the sartorius, the longest muscle in the body.
No way. Where is it?
It runs diagonally across your thigh from your hip bone all the way down to the inside of your tibia.
It crosses two joints then.
Exactly. It's called the talus muscle because it helps us sit cross-legged.
Ah, I've heard of it.
It also flexes, abducts, and laterally rotates the hip and flexes the knee.
Very versatile.
Indeed. Now, for the muscles on the front of the thigh, the quadriceps femoris.
Those get a lot of attention.
They do. 4 muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. They extend the knee, generating power for kicking, running, and jumping.
4 muscles working as one.
Exactly. And they all come together to form a tendon that inserts into the patella.
The kneecap.
Yes. And then it continues as the patellar ligament attaching to the tibia.
A powerful grip on the knee.
That they do. We've explored a lot of muscles in the hip and thigh.
It's remarkable how each one has a specific job.
It is. Ready to move on?
Yeah.
All right, let's explore those leg and foot muscles, the ones that move us forward.
Okay, sound good.
Starting with a muscle essential for lifting your foot upward, the tibialis anterior.
The one that runs down the front of the shin.
That's it. It originates from the tibia, inserts into the foot, it lifts the foot and inverts it, turning the sole inward.
So it's active when we walk, run, kick.
Exactly. Now, the muscles that extend your toes, extensor digitorum longus and extensor hallucis longus.
They run down the front of the leg too.
They do. The extensor digitorum longus extends all the toes except for the big toe, and the extensor hallucis longus is for the big toe.
Working together for control.
Yes. Now, on the outer side of the leg are the fibularis longus and fibularis brevis. Plantar flexion, pointing the foot down.
Like standing on your tiptoe.
Yes. They originate from the fibula, insert into different bones in the foot.
Similar actions, different attacks.
Precisely. Now, those calf muscles, gastrocnemius and soleus.
They're crucial for runners, right?
Absolutely. They're the main plantar flexors. The gastrocnemius is the big one, with those 2 heads you can see. It originates from the femur, crosses the knee joint, and joins with the soleus to form the Achilles tendon.
Which attaches to the heel.
Right. Now, the soleus originates from the fibula and tibia, those lower leg bones.
Different origins, same tendon.
Precisely. Now, for a small but important muscle behind the knee, the pollidius.
Don't know that one. What does it do?
It unlocks the knee joint. So to bend your knee from a straight position, the pollidius helps initiate that bending.
The key to the knee.
Exactly. Now, the tibialis posterior, a deep muscle on the back of your leg.
On the other side from the tibialis anterior.
You got it. It originates from the tibia and fibula and attaches to several bones in the foot.
A lot of attachments.
It does a lot. Plantar flexes and inverts the foot, and it supports the arch of your foot.
Some movement and stability.
Exactly. Now, the foot also has those flexor muscles for the toes, just like the hand. Flexor digitorum longus and flexor hallucis longus.
For curling the toes.
Right. Flexor digitorum longus flexes all the toes except the big toe. Flexor hallucis longus is just for the big toe.
And they help with plantar flexing the foot too.
They do. Now, the foot also has intrinsic muscles.
The ones within the foot itself.
Yes.
Yeah.
Like lumbricals, flexor digiti minimi brevis, abductor hallucis.
A lot of muscles in a small space.
Right. They control those fine movements of the toes, support the arches, and contribute to the overall stability of your feet.
It's incredible. This whole journey has been amazing.
It's quite a system, isn't it? We've only just scratched the surface, but it's a good start.
It really is. I feel like I have a much better understanding of how it all works.
That's what we're hoping for. Are you ready for a few more muscle groups, or are you feeling a bit overwhelmed?
Oh, bring on the last few. I'm ready.
All right. Ready for the last part of our muscle journey?
Absolutely. Let's do it.
Perfect. We'll be focusing on the upper extremities, those muscles that let us interact with the world around us.
Sounds good.
Let's start with those wrist flexors, the ones that bend the wrist forward.
Oh, yeah, I remember those. Flexor carpi radialis, palmaris longus, and flexor carpi ulnaris.
Exactly. Now for their counterparts, the wrist extensors, bending the wrist backward. Extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris.
They work together then to give us that full range of motion.
They do. Think of it like a seesaw. One group contracts while the other relaxes.
Makes sense. And don't forget the finger extensors for straightening our fingers.
Right. Extensor digitorum, extensor indicis, and extensor digiti minimi, they all originate from that lateral epicondyle of the humerus.
That bony bump on the outside of the elbow, it seems like a lot of muscles attached there.
It's a busy spot, a hub for those muscles controlling hand and wrist movements. Now, ready to revisit those amazing hand muscles?
Always. It's just incredible how much we can do with our hands.
Isn't it? Remember those three groups? The thunor, hypothenar, and intermediate muscles?
Yes. Thumb, little finger, and then the ones in the middle for those other fingers.
Exactly. They work together to give us that incredible dexterity. Now, let's head back down to the legs.
Okay, let's do it.
We'll start with the quadriceps femoris. Remember, those four muscles on the front of the thigh.
The quads. Rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius.
You got it. And remember the popliteus, that little muscle behind the knee.
Oh yes, the one that unlocks the knee so we can bend it.
Precisely. Now let's look at those muscles on the back of the leg, the ones that help us point our toes.
Okay, I'm ready.
We'll start with the tibialis posterior. It not only plantar flexes the foot, pointing your toes down, but it also inverts it.
So turning the sole inward.
Exactly. And it helps support that arch of the foot too.
So important.
It is. Now remember the flexor muscles in the foot, the ones that curl the toes?
Like the flexor digitorum longus and flexor hallucis longus.
You remembered. Flexor digitorum longus for all toes except the big toe, and flexor hallucis longus just for the big toe.
Wow, we've covered a lot of muscles.
We have. And last but not least, those intrinsic muscles within the foot itself.
Ah, yes, those tiny muscles that help with those finer movements of the toes and supporting the arches.
Precisely. They may be small, but they play such an important role in keeping our feet healthy and functional.
This has been an amazing journey. It's incredible how all these muscles work together, even the tiny ones.
It is. It's a testament to the incredible design of the human body, how everything is interconnected.
I know so much more now than when we started.
That's what we were hoping for. So keep exploring, keep moving, and take care of those amazing muscles. Until next time.